When COVID first started being in our scope of realization 2 years ago, none of us knew what to expect. And we were looking for some answers, and we were turning to our health experts, and that's when Dr. Stites and his team stepped in.
It was a perfect style of leadership during this time. It's the community that needed to win, and we needed to provide the resources, help each other to give the best outcomes. We've shared best practices, and it was largely because of Steve and his relationship with all the rest of the CMOs in this region.
COVID response is a team effort, and everybody in the team matters. But the team wouldn't exist without a team leader. So I believe he is unquestionably the leader.
Hey, good morning, everyone. We called this joint news conference to share crisis communication about the impact COVID cases are having on our hospitals and healthcare. This is hands down the toughest surge the medical community has had to face since the pandemic began in 2020.
What was so helpful was when Dr. Stites brought together chief medical officers from across the region to speak directly to elected officials, give us information, give us guidance so that we could make the best decisions possible.
Stay safe. Let's get through the next few weeks carefully. We can do that together. Thank you for listening. We're back with you tomorrow.
We really needed somebody with enough clinical gravitas to be able to speak to the public and let them know what is fact versus fiction. He does not have that air of I'm a doctor, I'm a specialist in this, so he's able to communicate at that level. That has helped him in communicating not only with lay public but also with the decision makers where they would trust him.
I think one of the most important things that Dr. Stites brought to us over these past 2 years is his sense of humor and his positivity. Going into the freezer with Dr. Hawkinson to show us how the masks work.
We take our masks off and what happens? Now we talk. There's our breath. We take a deep breath.
That was just as important as the reassurance we needed from the health information.
He really put a face to what healthcare workers were facing. I think you saw that during the entire spectrum of the updates. To feel it from the heart, to know where our folks are, that they're just completely overwhelmed, and they're exhausted and they're burnt out. And I've heard him, and he doesn't mince words at all. And said, we are near crisis standards of care. We have this going on, and if we don't take an abrupt stop, we're going to collapse this system. And we needed that. I mean, numbers are important, but there's also what comes from the heart.
As an elected official, I especially appreciate your bringing together all the chief medical officers to give us information and guidance. You've been a true gift to our region and our communities.
First of all, thank you very much. But I said I can only accept it on behalf of myself, but also all the chief medical officers in our region, and Doc Hawk, and our entire team here in this studio. This is a team effort. It is always a team effort. No one person does this. And I work with an amazing team, and I accept this award on behalf of everyone and appreciate the kindness, but also the knowledge that it represents the work of a great group of people who have come together and tried to tell the story as best we knew. If there's anything we've tried to do, I keep coming back to this one thing, the intersection of faith, hope, and science. The faith that allows us to stay true to what we're trying to do work together. The hope that we can have a better day, and the science that has delivered a better day.